My name is Jonathan Kitano. I'm with the paramedic course at Cedar Valley College. I am doing a project for my class P162 for Professor Winters. My project is on the Uvalde school shooting. On May 24th, 2022, a mass casualty incident occurred at Robb Elementary School in Uvalde, Texas, resulting in the death of 19 children and 2 teachers. While the public narrative is often centered around law enforcement actions, this incident is equal, if not important, to examine from the EMS standpoint. From an EMS perspective, the Uvalde highlights how delayed access to patients, failure incident command, communication breakdowns, and the lack of integrated resources operations can directly affect survivability. This is not about assigning blame, it is about understanding how EMS systems function or fail during complex, high-threat incidents and how we can improve in future responses. One of the most critical EMS issues at the Uvalde was accessing the actual patients themselves. EMS resources were present when available early in the incident, however, medical providers were unable to reach the victims. According to the U.S. Department of Justice Critical Incident Review, victim survivability remained without medical care interventions for an extended period of time. In penetrating trauma, particularly in pediatric patients, minutes matter. Uncontrolled hemorrhage, airway compromise, and shock can become fatal without rapid intervention. From the EMS standpoint, this demonstrates fundamental problems to control the scene, prevention of life-saving medical care given immediately. Modern active shooters for the MCI recognize that EMS cannot wait for fully secured scenes. Instead, controlling, coordinating access, often through resource task force or similar warm zone concepts, is essential. When the EMS is staged without clear direction or integration, patients' outcomes suffer regardless of how many ambulances are available. The central theme across all investigations is failure of the incident command to unify. For EMS is the failure of direct operational consequences. The Texas House of Investigation Committee found that the command was unclear, fragmented, and ineffective. There was a confusion over who was in charge, what was operational objectives were, and how the resources were included in the EMS were deployed. Properly functioning ICS structure would be the EMS has a defined role in operations, which is also the actual main role for most things within operations, which is the actual units that are making plans to do things for the situation. Medical branch or groups establish early triage, treatment, transport decisions are coordinated, hospitals are notified, and surge capacity is managed. At Uvalde, EMS was largely reactive instead of proactive, waiting for directions that never clearly came. Without functioning unified command, EMS cannot safely use resources, operations, and establish treatment areas. The coordination transport decisions, this is reinforcing that ICS is not an optional during a mass casualty incident. It is the backbone of effective EMS operations. Another major EMS issue at Uvalde was delayed triage of the patient and movement of the patients. The DOJ reviews conclude that early medical interventions could have improved the outcomes for some victims. This is a critical statement for EMS professions, which the absence of timely triage and transport was not merely procedural, it was affected survivability. Some key aspects that are in concern: no immediate organized triage inside the affected classrooms, delayed hemorrhage control and management, delay in extrication of patients and definitive care, lack of coordinated transport decisions in appropriate trauma centers. In mass casualty incident involving children, EMS systems must be prepared for high stress, high acuity, high emotions that must translate in automatic application of MCI protocols. Not hesitation, paralysis due to uncertainty. Communication breakdowns further compound the EMS challenges at Uvalde. EMS personnel did not consecutively receive accurate or timely information regarding the threat status, when and where the patients could be accessed, which patients had been accessed, and when it was safe to move forward with medical operations. The DOJ Critical Incident Review identified system communication failures, including the lack of radio usage, poor information between agencies, and other things. For EMS, communication failure means delay in entry, inability to prioritize patients, use of resources, and no command to follow. An MCI, situational awareness, life-saving information, without it, EMS cannot function effectively regardless of its training or staff level. For EMS standpoint, Uvalde reinforces several critical lessons that must be enforced for future training and policies. 1, EMS must be thrown into unified command early and establish roles early on. Medical operations cannot be sought afterwards. EMS leadership must be seated at the command from the very beginning. Rapid professional-based access to lives. EMS providers must be trained to equip, authorize, operate in the warm zone with law enforcement support if we are allowed to. MCI protocols must be activated immediately. Triage, treatment, transport coordination should automatically be put into place, not delayed for the incident. Joint training is established. All EMS, fire, police, and major other corporations that work together on the government level should all be training together to bring each other together for these types of roles, especially since the shooting, or mass shooting, should I say, is becoming a larger incident within EMS and within the United States. From EMS perspective, this shows that the lives can be lost that lives can not only be lost because of violence, but delayed medical care and communication structures and command structures as well. Studying Uvalde and not criticizing and for the accountability, EMS professionals should be putting themselves responsible for ensuring that our patients get care, and we put ourselves first as well to make sure that we're not going to be in harm's way. If these lessons are applied, everybody across the nation will be able to help all MCIs and further. The investigation committee, these are my sites. So a couple of the other points that I wanted to point out for the plan was that San Antonio Fire Department actually showed up on scene, set up unified command as well, and they actually helped the family move back. There were actually ambulance on scene, and then there was also the fire department that showed up on scene as well. But for Uvalde's fire department and EMS is all volunteer-based. So for the volunteer side, a lack of command and structure wasn't really put into place, because to be a volunteer firefighter, you only need ICS training and a little bit of training with a nozzle, as well as EMS protocols. They may have been EMS certified. There was 2 helicopters on scene with another additional 2 staged. Access was not granted via law enforcement. Entry was delayed. I'd like to also point out that families and other bystanders were actually within what I would consider the warm zone, within shooting distance of the school, actively waiting for their children. As soon as San Antonio was actually on scene, they actually moved people back and then later gave extra resources for the firefighters who were under stress and EMS personnel who were also under stress due to the situation. They also left one of their EMS MICUs. I guess it's not a MICU because San Antonio is EMT fire. They actually left an ambulance to help run the calls while all the other EMS professionals were under stress.